Good afternoon, everyone. Welcome to the Assembly Committee on Health and Human Services. Madam Secretary, please call the roll.
Assemblywoman Benitez Thompson, Assemblywoman Black, Assemblywoman Gorlow,
Here.
Assemblyman Hafen, Assemblywoman Krasner, Assemblyman Matthews, Assemblyman Orentlicker,
Here.
Assemblywoman Peters,
Here.
Assemblywoman Summers Armstrong, Assemblywoman Thomas, Assemblywoman Titus, Chair Wynn.
Here. And I know other members are making their way in here, so if we can just mark them present when they arrive. And I believe Assemblywoman Black is appearing with us via Zoom, so I would just ask her to briefly turn on her camera when she does appear so we can mark her present as well. And with that, we will get started. I do have several things on the agenda. For those of you that are waiting because of the length of our agenda, because of the length of floor today, and some other scheduling factors, if you are waiting for the work session for any of the bills that we have heard, we will not be doing the work session today. It is going to be, look forward to the agendas. I'm sure that at some point, either today, tomorrow, or Saturday or Sunday, we will be doing those. So just kind of keep an eye, members, on the for your emails. And for the members of the public, it will be posted as soon as possible on our agenda on Nellis. And with that, we will begin. We have bill hearings today, so I'm going to skip to that. And I see Senator Ratty, so I'm actually going to call her first on Senate Bill 69. So at this time, I will open the bill hearing on Senate Bill 69. This does revise provisions governing mental health. And welcome, Senator Ratty. Please begin when you are ready.
Is that something you do to senators? You put the chair down all the way to the bottom so that when we get here, we don't look
We
quite...
lift ours way up and then, shorten yours.
Good afternoon, everyone. My name is Senator Julia Ratty, and I represent Senate District 13. However, today I am here as with the privilege of being the president of the Washoe County Regional Behavioral Health Policy Board. I think by this time in the session that you are well aware that there are 5 regional behavioral health policy boards. I am lucky enough to be able to share being on that board with Assemblywoman Peters. And so I'm here today really representing the coalition of folks in Washoe County who have been appointed to focus on behavioral health needs in our region. And I think you all know that each one of those behavioral health boards gets a bill draft request. And so this is the BDR that is coming forward on behalf of that board. In the Senate, early in the session, we had a presentation that included 6 individuals and all kinds of information. I suspect that that is not what you are looking for at this point in the session, so I'm going to endeavor to do most of the presentation, but I do have a whole team of subject matter experts on the Zoom for when we get to questions that I may ask to help me out. In Washoe County, our process was that we put a call out to the community and we asked the community to bring bill draft request ideas forward to us. And we had a wonderful participation, and we probably got about 5 or 6 distinct ideas for behavioral health policy that the community would like to see us move forward. Some of those bills that didn't get selected, myself and Assemblywoman Peters have carried as individuals, but what the board coalesced around was perhaps a little bit of disappointment or maybe frustration that when we talk about behavioral health broadly, often substance use disorder gets left out of the conversation, and substance use disorder is clearly a part of behavioral health. So we made the decision as the Washoe County Behavioral Health Board to focus explicitly on substance use disorder for our BDR. Then we tried to shove as many ideas in there as we could because we had a hard time saying no to some good ideas. So there's a couple of things going on in this bill. First, this bill includes the certification of peer support specialists and their supervisors. So you may recall way back at the beginning of the session when I did a presentation on the crisis continuum of care, and that we would have the call line, and we would have mobile crisis teams, and we would have crisis stabilization centers. And you may remember as part of that presentation, I also talked about a specific workforce that would be important to that, and that would be what we call peer recovery support specialists. And this is a workforce of peers with lived experience. So these are individuals who have experienced a behavioral health diagnosis, have experienced a substance use disorder, and they become a very critical component as part of our healthcare teams. We are getting tremendous evidence that if you have a behavioral health professional, like a psychologist or a clinical social worker or a psychiatrist or a APRN with a psychiatric endorsement, and a peer, someone with lived experience, that a pair of folks working with a person who is experiencing either a substance use disorder or a diagnosis of a mental health issue, that those individuals can be very powerful in terms of supporting and helping as part of the care team. Because that is becoming more and more recognized, we are needing to professionalize that workforce. And so this is not a licensing process. This is not a heavily burdensome, expensive, highly credentialed licensing process. Rather, it is a credentialing process that goes through a third-party agency that already does credentialing for many similar types of individuals. And the credentialing process becomes important because if we have, first, because these peer support specialists get training and they get good training around ethics and boundaries and all of those good things, then they also are better positioned for the agencies who want to hire them to be able to bill Medicaid for their services. And so that becomes then a more sustainable model in terms of being able to provide care in our community. So really important that we get peers into the mix. When you do get peers into the mix, you get a much better diversity of providers who are working with folks. If you think about the mobile outreach teams, for example, that are going to be meeting people in their living rooms, at the street corner, having that peer just makes all the difference in the world. Or even the Crisis Stabilization Center, where there are folks with lived experience in that living room model helping people to recover. So that's the first part of the bill. The second part of the bill is focused on substance use prevention. And so it has three components. First, it is seeking to do a better job of having evidence-based substance use prevention in our school settings. So we already have substance use prevention requirements in our school curriculum standards. But what's happening in the field is that not all of the substance use prevention curriculum that's being delivered is actually evidence-based. And so all this does is it asks for the Department of Education to publish a list of substance use curriculum that is evidence-based. So if you are, from a superintendent on down to a classroom teacher, interested in making sure that the substance use prevention curriculum that you're doing in your classroom is going to be effective, you can go and look at this list and look for the evidence-based curriculum. So it does that. It does some technical changes to the Youth Risk Behavioral Surveillance System, the YRBS. So what the YRBS is a survey that we do regularly in schools that gives us the data that we need to know that we are targeting our prevention and intervention programs to the right areas. And it provides for some updated language on the certification of our substance use coalitions. So there are 10 coalitions across the state, and the language in NRS did not provide clarity for what their critical role was in the community, so it clarifies that language. So those are the four things: certify peer recovery support specialists, make sure that we have evidence-based programming on substance use disorder in schools, some tweaks to the YRBS survey, and some memorializing in statute of the role of the substance use coalitions in our community, which are, again, community-based organizations in 10 jurisdictions across the county. So I think I'll just go ahead and stop there. It's a long bill because of all of that. And again, the Washoe County Regional Behavioral Health Board apologizes for being ambitious and putting 4 things in one bill. But we just felt like they were all worth bringing forward. Thank you.
Thank you, Senator Ratty. I'm looking around here. Do we have any questions from committee members? And I'll go to you first, Vice Chair Peters.
Thank you, Chair, and I'm excited for this bill. I know the work that went into this and the ideas around it are familiar to me from our board experience. I had a quick question, though, about the 5-year look back for professionals working with children. And I wish I had written down the section because now I can't remember which section it is. But I just wanted to talk about a little bit about the rationale of the 5-year look back rather than a broader period of time. I think it is pulled from another section, so it's a continuation, I think, of the policy. But I just wanted to clarify.
Thank you, Senator Ratty. For the record, I'm going to phone a friend and ask Joanna Jacob from Clark County to come up and speak to that. Through you, Chair Wynn, to...
Feel free to go directly to the member.
Thank you. Assemblywoman Peters, you may not recognize that because this evolved during the session and came as a request. So very important that we have peers with lived experience working with individuals. Also very important that we are protecting children. And so this was a request from the county, and I'll let the county speak to it.
Thank you, Senator Ratty. Chair Nguyen, members of the committee, Joanna Jacob, Government Affairs Manager for Clark County. It's true, we did work on this bill with the Washoe County Behavioral Health Policy Board and Senator Ratty. Assemblywoman Peters, that is actually pulled from similar provisions in law right now around the child care and abuse registry, the state registry that we have in place. And we modeled these provisions after the similar regulations that we have for people who work in child care facilities working with small children. So licensed child care facilities. It's a 5-year look back for the records that are in that registry. And so it's modeled after similar already existing protections for people who are working with children on a regular basis. And the reason why we did that is the original language of the bill had registration for people, I guess, having to do with elder abuse, but we wanted to incorporate the similar protections for child abuse and neglect. I will also point out, since I have the microphone, why did Clark County get involved in this is because we actually believe in this model and it has an application in child welfare, which is something we've worked on with Senator Ratty as well, especially with some of the federal laws coming in. So we also wrote in a waiver process because of the shared experience that we have here. And you'll see that also in section 15.6, where there is a waiver process that we'll work on with the state and with the child welfare agencies, because the model is shared and lived experience. When you're working in a child welfare setting, they might have a child abuse or neglect complaint, but that's what makes the shared experience so valuable. So we would be able to set a regulatory process to provide that waiver. So that's how we worked with Senator Ratty on that provision, and just thought I would take that opportunity to explain that. Thank you.
Thank you. I appreciate you taking the time to put that on the record for us.
And Assemblywoman Thomas, I believe, has a question.
Thank you, Madam Chair, and thank you, Senator Ratty, for bringing this SB 69 forward. It sounds like a really good program, but my question actually has to do with the peer recovery support specialist. With that said, and I know that that's lived experience, I just want to know what type of training would they go through, if any?
Thank you for the question, Assemblywoman Thomas. I'm going to do another phone a friend, and I believe that Sean O'Donnell is on the Zoom. There he is, and Sean is representing Foundation for Recovery, that is specifically the organization that does training for peers to help them achieve certification. So, Mr. O'Donnell, if you could elaborate on that.
Yes, absolutely. Sean O'Donnell for the record. So the training that is currently required, and this is pretty standard across the nation, it's a 46-hour training, typically delivered in person, and it covers topics such as ethics, confidentiality, such as HIPAA and 42 CFR Part 2. It also covers how to provide different types of training on tools to use when providing peer recovery support services, such as motivational interviewing, active listening, those types of things. And so it is a 46-hour curriculum. And if one seeks certification, there is a state examination that you would sit for as well. And prior to sitting for that examination, in addition to completing the 46-hour classroom component, there is 500 hours of practical experience, which you can get by volunteering or working for an agency to get that experience providing peer support. And then an additional 25 hours of supervision. So where you're actually being supervised by a peer recovery support specialist supervisor while you're providing these services. Thank you.
Thank you. And follow-up, Chair, please.
Go ahead.
Would that include, let's say, the spectrum from child, youth that are involved in drugs per se?
So thank you, Assemblywoman. It's a great question, and I do think that this is a place for some clarity. There are some youth peer-to-peer programs where you have a child who has unfortunately experienced some substance use disorder and has those experience working with another child who may be at risk of or is also experiencing substance use disorder. Because of, as you can imagine, liability and any other number of reasons, we would not be certifying people who are under the age of 18 to be a healthcare professional working in a peer recovery support specialist role. They are specifically excluded. Really, a youth-to-youth program is a very different thing. However, you could have adult peer recovery support specialists working in a setting where there are some youth involved. And I'll give you a pretty good example in our community is we have the family shelter for our homeless services. And so you're gonna have a mix of adults and children there, and a peer recovery support specialist could be working in that environment and be working both with the adults in that setting and the young people in that setting. So I hope that adds some clarity, but we really want to be clear that we're not trying to capture the youth peer-to-peer in this. That is something very different, more like a mentoring program than a professional healthcare workforce.
Thank you. I appreciate that answer. Thank you, Chair.
Thank you, Assemblywoman Thomas. I'm looking around here. Do we have, we have Assemblywoman Gorlow.
Thank you. And I want to go back to, because I apologize, I missed the hours of supervision. There was 25 hours of supervision and 15 hours of, I missed that.
Mr. O'Donnell, again, Julia Reddy for the record. Go ahead,
Yes,
Mr.
hi,
O'Donnell.
Sean O'Donnell for the record. Thank you. 500 hours of practical in-person experience, and then 25 hours of supervision and 46 hours of classroom learning.
So 500, not 15, big difference.
500.
Thank you for that
Correct.
clarification. And also, is this based on like a national guidelines or is this Nevada specific?
Go
Yes,
ahead,
thank
Mr.
you.
O'Donnell.
Great question, Sean O'Donnell for the record. Thank you. Sean O'Donnell for the record. It is based off of national standards from the International Certification and Reciprocity Consortium, which handles certification for peer recovery support specialists in almost every state.
I am taking a look around the room here to see if we have any other questions from committee members. Seeing none, at this time we will begin testimony in support of Senate Bill 69. If you are in the room here to provide testimony in support, I'd ask you to come up to the table. Please remember to state your name and limit your testimony to 2 minutes.
Good afternoon, Chair and Wynn, members of the committee. Joanna Jacob again, Government Affairs Manager for Clark County. I just wanted to say we are in support of this bill and the many amendments that Senator Ratty worked on with us in the other house. The reason, as I stated before, that we got involved in this is another day I can talk to you about child welfare in this committee. With the advent of new federal changes, the Family First Prevention Services Act, we are doing a fundamental shift in foster care as that comes online. Peer support recovery specialists are an evidence-based practice that we can build into the implementation of that act, and we'll really focus on moving child welfare into prevention activities. So the shared living model is going to be one that we do plan to pursue in Clark County. We want to thank Senator Ratty and the whole village of people who worked on this bill. If they're on Zoom, I want to say thank you to Mr. O'Donnell and Ms. Edwards as well for working with Clark County on this, and we are in support. Thank you.
Thank you, Madam Chair, members of the committee. This is Joan Hall. I'm representing Nevada Rural Hospital Partners, supportive of all the components of this bill, but specifically the peer recovery support services, as they are a vital component in providing care to patients and their families with substance use disorders, behavioral health issues, and co-occurring disorders. Certification provides public protection in demonstrating training, education, and standardization. As we move through the Crisis Now standard in Nevada, and we've just passed the crisis stabilization units, these peer recovery support people will be very important in those units, as they are in our most teams. We urge your support. Thank you.
Thank you. Seeing no one else coming up to the table in support of Senate Bill 69, Broadcast Services, if we can please go to the phone lines.
To testify in support of Senate Bill 69, please press star 9 now to take your place in the queue. Chair, there are no callers on the line to testify in support.
Thank you, Broadcast Services. At this time, we'll begin opposition testimony of Senate Bill 69. If there's anyone in the room, please make your way to the table. Seeing none, Broadcast Services, is there anyone on the line in opposition?
Chair, there are no callers on the line in opposition at this time.
Next, we'll go to neutral testimony. Is there anyone in the room to testify neutral on Senate Bill 69? Seeing none, there may be someone on the Zoom. If you are on the Zoom to testify neutral of Senate Bill 69, please unmute and turn on your camera. Don't see anyone. I did see someone registered, so I wanted to double check. Broadcast Services, if we can go to the line for neutral testimony.
Chair, there are no callers on the line to testify in neutral.
At this time, I will ask Senator Ratty if she'd like to make any closing remarks.
Thank you, Chairman. Again, Julia Ratty. For the record, I would just like to point out one piece. This is a 2/3 bill, and the sections that make it a 2/3 bill are primarily Section 9, which establishes the fee for certification, allows the board to establish the fee for certification. And I did want to make it very clear that this was not the Washoe Regional Behavioral Health Board thought, hey, you guys need to be certified. This was the peers themselves and the organizations that work with peers and represent peers came to us and asked. They have actually been working now. This will be, I believe, the 3rd legislative session where they have tried to get peer certification across the finish line. And so if Mr. O'Donnell just wants to comment one last time, that I just want to make it very clear that it is the peer organizations themselves that are asking for this certification process.
Yes, thank you, Senator Ratty. Sean O'Donnell again for the record. Senator Ratty is absolutely correct. We did bring this after listening to the community and holding many different platforms for peer recovery support specialists in the state of Nevada to voice their opinion on this. We've been working on this for the past 3 legislative sessions, and this is going to do great things for peers and the peer recovery support specialist workforce in our state. So thank you.
Thank you. And before you leave, Senator Ratty, if I could just ask you a question. I know that we have several new legislative members. Can you kind of just kind of briefly describe how that regulatory process would work and how the Ledge Commission would like kind of approve those regulations as they work their way through the process if this bill was to pass?
Sure. Again, Julia Ratty for the record, just generally, when we call for regulations in statute, then the appropriate regulatory body promulgates those regulations. And once those regulations are promulgated, they have to come back to the Legislative Commission, which in my first session, I didn't even know there was such a thing. But it is kind of like the executive committee of the legislature, for lack of a better description. They meet during the interim, and they have to sign off on all regulations. It's sort of a check and balance, if you will, that the executive branch that promulgates the regulations doesn't get too far askew from the legislative's intent. So they bring it back to this legislative body. That legislative body signs off on it, and then those regulations become part of the Nevada. Oh my gosh, what does NAC stand for? Administrative Code, just went out of my head, the Nevada Administrative Code. So they aren't in NRS, but they are in NAC, which still has the full force of law. Does that help?
Perfect. Thank you, Senator Ratty, and thank you for your presentation on Senate Bill 69. So at this time, I will close the bill hearing on Senate 69. I know Senator Ratty has her own meeting to chair of Senate HHS, so I will let her get on her way. I also see another senator sitting here. I've spent a lot of time with her this morning, so I'm glad to see her this afternoon. If we can welcome Senator Harris up to the table, and I will now, and I just wanted to put on the record that Assemblywoman Black is present on the Zoom, as is Assemblywoman Summers Armstrong, Assemblywoman Benitez Thompson, and Assemblyman Hafen, who have all arrived. They arrived right shortly before the hearing started. So I just wanted to make sure that was on the record for our committee staff to mark present. So at this time, I will now open the bill hearing on Senate Bill 211. This establishes requirements relating to testing for sexually transmitted diseases. And I will turn this over to you, Senator Harris, to begin when you're ready.
Good afternoon, Chair Wynn and members of the committee. My name is Dallas Harris. I represent Senate District 11. Thank you all so much for the opportunity to present Senate Bill 211 to you all today. I will endeavor to keep it short, but I said that this morning and failed miserably. So just know I'll make my very best effort. I believe I have Ms. Radeloff on the Zoom with me as well. Can we confirm that before I kick it over to her? And oh, there she is.
There she is. I was going to say, I thought she was on there.
There we go. Great. So, in the simplest of terms, Senate Bill 211 just requires primary care providers to ask their patients, 15 or older, if they'd like a test for a sexually transmitted disease or HIV. That recommendation of which ones you should be tested for should be based upon your medical history. No requirement here that you get tested for everything under the sun. But if coronavirus has taught us anything, knowing your status is key. And unfortunately, the state of Nevada has unbelievably high rates of syphilis, both congenital and the other type, and other STDs. This recommendation comes from the CDC. It is best medical practice, and so we're putting it into law as a tool to try and address some of those rates. Ms. Radeloff has a wonderful presentation that is available to you all. It should be posted on Nellis. Unfortunately, I'm going to ask her to forego the whole presentation and leave her there to answer questions unless, Chair, you'd like her to walk through all of the details.
If she'd like to do a high-level overview, I know most of our members were provided this information last week, but if you wouldn't mind doing that, I think that would be good for the record.
This is Cheryl Radeloff for the record. Hello?
We can. It's a little choppy.
Okay, sorry about that. And if it's okay, I will just go high-level overview. Again, Cheryl Radeloff for the overview. Some points to consider. Thank you, Senator Harris, for the outstanding overview of the bill. As mentioned, Nevada consistently has had some of the highest rates of HIV and STDs or STIs in the United States. As of 2019, we were #1 in the nation for rates of primary and secondary syphilis. And we had over 800 cases. We were also #4 for genital syphilis, and that was basically in 2019 went from #2 in 2018 to #4. But our rates are still high.
I think do you have something covering your microphone? It kind of cuts in and out, like there's something covering it, or maybe it's your hand.
I don't. Is that better?
Yes, that's much better.
Okay. This is Cheryl Radeloff for the record. Would you like me to go over this a little bit then, or? I will.
Hold on for 1 second here. Is anyone else having difficulty here? I think we're all, maybe if you're able to maybe turn off your camera and we can hear audio, sometimes that helps.
That better for everybody?
I think so far. I'll stop you, unfortunately, if it is. It happens. So why don't you try to begin again, and we'll see what we can do. But the high-level overview is perfect.
Okay, thank you. So just as Senator Harris mentioned, Nevada has consistently had some of the highest rates of HIV and STIs in the United States. We were number 1 in the United States. We were ranked number 1 for primary and secondary syphilis. We were ranked number 4 in congenital syphilis, and that's changed from number 2 ranking in 2018. We were ranked number 17 for rates of chlamydia, and we were ranked number 15 for gonorrhea. And just to give you an idea for congenital syphilis, I just gave a presentation to some UNLV School of Nursing students. From 2014 to 2020, we increased 1,300% in cases of congenital syphilis. We went from 3 cases in 2014 to 43 in 2020. So that's something I think that is quite alarming. The majority of HIV cases in Nevada are diagnosed in inpatient and outpatient hospitals and private physician offices. Also, locations where the diagnosis of STIs is similar to HIV. Patients do want routine sexual histories, access to free and low-cost, confidential, and convenient testing for HIV and STIs from providers, and that many providers offer testing based on subjective, not always a routine approach. And so it's dependent on patients to report presenting symptoms. There's a lack of policies for offering routine HIV and STI testing, a lack of awareness of HIV and STI risk on the physicians, also on the part of the client as well.
You know what?
Many may not offer.
I'm going to go ahead and have you stop. It's just it's unfortunately we have a really poor quality of audio. I think we're hearing every third word and it's very loud. Senator Harris, would you mind if we went to you? I know that the bill is not very long, but I know that a lot of the information that was just spoke to is actually in the exhibits that are already included as a part of the Nellis if you go on there. But would you be ready for questions at this time, or are there things that you would like to highlight overall?
Chair Wynn, I think the summation of her numbers they aren't good. And so this is a tool to help us get that down. One thing that's important that she said that was a little difficult to hear is that often right now this is not a routine part of the primary care. We rely on patients to present symptoms as opposed to getting them tested as part of their regular primary care. An important piece to that is reducing the stigma behind HIV and STDs. If we can just normalize the idea that you should get tested as part of your regular medical care. And so that's what the bill does in the hopes of trying to address what's a very serious issue. And I'm more than happy to answer any questions. Ms. Radeloff, thank you so much. By the way, she put together that presentation along with Jen Howell. That is your exhibit and has done a lot of great work on this bill.
Thank you. And I know that sometimes we have some technical difficulties. I'm glad that we have the senator here in person to be able to clarify any of those kind of concerns. And again, I encourage all the members to look at all the documents, which I'm sure they already have, that were on Nellis. Do we have any questions? I see one from Assemblywoman Titus. And if you have others, you can message me or I can look around.
Thank you, Madam Chair. Thank you, Senator, for bringing this forward. I think this is a good bill, and I am as equally appalled as you are and other members when we find out that we're number 1 in congenital syphilis and some of these other issues. So I think it's important. I think the changes in healthcare, when I would do the recommended pelvic PAP on a young woman for the first time prior to prescribing birth control, we would do some of these tests, not necessarily HIV per se, but that was just part of the process. Now we've learned that we don't do routine pelvic exams, so we're not doing these tests, routinely anymore. When you can have an opportunity to capture a person, you have them in your, not necessarily capture in the sense that you're strangling them, but capture them that you have them there in front of you. You would hate to miss an opportunity. My question is, this is mandating certain things as a provider should be doing. Where's the piece of payment? Who pays for these tests? And it may be in here and I'm just missing it, but I'm just concerned that we're mandating a provider orders the test, or we ask if they want to have the test done. There's always concerns about the cost of these tests, and some of these are blood tests, others are not blood tests, and just wondering about that process.
Thank you for the question, Assemblywoman Titus, to you through Chair Nguyen. The bill does not, as you mentioned, mandate that the testing actually occur. It only mandates that you ask. What you will see, and this is why the bill is coming to you all so late, is that we did get an appropriation for those folks whose tests that are covered by our Medicaid. That is the state cost. Otherwise, this bill would operate in the same way it would today if you went and asked your doctor for a test. Your insurance would cover it, or again, if you have Medicaid, they would cover it, or you pay your copay. Nothing would change about that. And again, the bill is really just about requiring the provider to ask.
I have a couple of questions. Is this something that routinely the practitioners that are working, are they asking this already, or is this like a problem?
Thank you for the question, Chair Nguyen. I'm not here to disparage any providers. There are some who do it as a regular course of practice. I think it's more common for the STDs than it is for the HIV. But we do have a fairly significant HIV transmission issue here in the state as well, and so I'm trying to make sure that that practice is also normalized. I can say that it is best practice to talk to your patients about getting tested, and it's my hope that we will bring in some more doctors who are doing it regularly. One thing that is new in this bill is it does speak to emergency care providers. As I'm sure this committee knows, there are some people who get their primary care through the emergency room, and so I anticipate we will see a lot of growth in that arena.
Thank you. Next, I believe we have Assemblyman Ornlicker.
Thank you, Chair, and thank you, Senator Harris, for bringing this bill. I just was curious about the 15-year cutoff, because as I look at the presentation from Ms. Radeloff and Howell, it says that CDC recommends HIV testing starting at age 13. So just curious about the 15-age cutoff.
Thank you for the question, Assemblyman Ornlicker, to you through Chair Nguyen. Please note that the 15-year cutoff is just when the provider shall ask. I encourage them to ask any of their clients who they feel may especially be at risk for HIV if you're sexually active at any age. The bill does not prevent providers from asking anyone younger than 15, but that is the age that we came to when trying to put this bill together about when it should be a regular practice.
Assemblywoman Gorlow, and feel free to go directly to the legislator.
Thank you very much, Chair. And thank you for bringing this. I think it's really important because so many people have a sexually transmitted disease and don't even realize it because they don't have symptoms. So I think it's very important. So thank you very much. But now that it's going to be mandated, what happens if a doctor is not doing this kind of ask? Because that's all I really need to do.
Thank you for the question, Assemblywoman Gorlow. Dallas Harris, for the record. So I thought a lot about that. Originally in this chapter, there is a misdemeanor for anyone who does not comply with the chapter. I was not looking to create a new misdemeanor, and so this bill will be enforced by the licensing boards of the providers. And so, there's no criminal penalty attached at all. That will have to be dealt with the proper licensing board, as I think it should.
Thank you very much.
Head Assemblywoman Benitez Thompson.
Thank you so much. I appreciate it. It's a good bill, and we absolutely need to make sure that we're getting people tested. So I guess then practically, as you would want this to look, you would want the primary care physician to be asking. And then I guess what you would want is, let's say if someone's in to see their primary care physician 3 times within the year, I guess would you want the physician, if they see in the chart that there's a recent test, then they can acknowledge the test or talk with them about the test and see if they want to be retested, or if they would look at the chart and see no recent testing, then they would ask for testing. I guess I'm wondering, like on multiple visits, at what point what would be reasonable what do you see as reasonable for that kind of expectation?
Thank you for the question, Madam Majority Leader. I believe that would likely vary upon possibly how sexually active a client is. My own estimation is once a year is more than sufficient to kind of make this a regular practice. Really what I want to make sure doesn't happen is that someone goes for a substantial amount of time without being asked for a test. If they're asked 3 times in a year, that would also be great if that's what they so choose to do. And I think that's a discussion that they'll have with their doctor about how often it is appropriate.
And I appreciate that. I think that once a year is good, especially when people, if they have chronic health conditions or such, we just want to make sure that physicians aren't, like there's lots of chart audits. I know Dr. Titus and I have lived through lots of chart audits. When Jayco walks through the door and you do everything from like, they're going to stand there and watch you to make sure that you have your correct hand washing, right? And if you don't wash your hands exactly correct, which I promise no one but Dr. Titus and I are doing by Jayco standards, right? Like you get docked. So like in a chart audit, the intent would be that the question is asked once a year. Hopefully there's testing once a year, but that there's somewhere a notation in a patient chart that the question has been asked.
I think that's correct. Yes, thank you.
Assemblywoman Peters?
Thank you, Madam Chair. And I had kind of a similar question about like the mechanism in which you ask, whether it has to be verbal. I don't see that in the bill, or if it can be on like your check-in paperwork and just have a line item of there, would you like to be tested for STDs today, or HIV, and have it be just a regular thing that happens in those like initial paperwork as you come into the office, and that way you don't have doctors asking every time and making uncomfortable situations when you're, in there for stitches or something. So I'm just wondering if that is a possibility under this bill.
Thank you for the question, Assemblywoman Peters. Absolutely it is. I did or require the verbal each time. I think there are a lot of ways that doctors today comply with types of notice requirements to their patients, and there is plenty of flexibility for that in this bill.
Assemblywoman Summers Armstrong?
Thank you, Madam Chair, and thank you, Senator Harris. Spending a lot of time together in meetings these days, but you always bring very thoughtful and interesting legislation for us to consider. 15, that's a minor, and often that child would be coming in through a pediatrician for an annual exam. What kind of discussion have you all had around that fact? I don't know about anybody else, but I have 3 sons, and I accompanied them and stayed in the room for all of their exams, which was prescribed under their physicians. And so how have you all thought about managing that?
Thank you for the question, Assemblywoman. That's always a really, really tough issue. I know that doctors have plenty of experience trying to figure out when's the right time to allow a parent in, or when they may need to ask a parent to leave in order to deal with their patient and possibly get honest answers on some of these sensitive issues. I imagine this will be a discussion between the doctor and the patient, and in appropriate circumstances based upon the child's age, the parent as well.
And I'm looking around. Do we have any other questions from committee members at this time? Seeing none, I will begin testimony in support of Senate Bill 211. If there's anyone in the room to provide testimony, I'd ask you to come to the table right now. Again, reminder to press that mic button and say your name for the record, and please limit your testimony to 2 minutes.
Thank you, Madam Chair. Bradley Mayer, for the record, partner with Argentum Partners, BRADLEYMAYER, representing both the Southern Nevada and Washoe County Health Districts today. As Cheryl was mentioning some of those points that I can reiterate that we didn't hear, this is an important bill because Nevada does have some of the highest STI rates in the country, and especially as it relates to HIV, the highest infection rate in the West. And so, we know that in order to stop the spread of HIV, people need to know their status. And so in a lot of cases, let me get this right here, in 40% in recent years, almost 40% of new transmissions came from those who did not know they had HIV. And so if we can identify those cases, get people into treatment quicker, get their viral load suppressed, then they will not be transmitting at the same rate. And so this bill, and as was mentioned, similar legislation that's moving along, AB 192, that deals with syphilis testing, are really important to make sure that we're staying ahead of this and making this part of the standard of care is, I think, what's most important. So we really thank Senator Harris for her. She did awesome work on HIV policy this session, and this bill included, and so we really appreciate her for engaging with us and urge your support, and thank you for your time.
Thank you, Chair Wynn and members of the committee. Allison Janko with Ferrari Public Affairs, representing Dignity Health St. Rose Dominican for the record. I'll keep it short and sweet. We are here in support of SB 211 and want to thank Senator Harris for her work on this bill. Thank you.
Thank you. Seeing no one else at the table in support of Senate Bill 211, Broadcast Services, can we go to the line to see if there are any callers in support?
To testify in support of Senate Bill 211, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to participate at this time.
Thank you. If we can
Oh,
go to,
I'm so sorry. One second, there is one.
No problem.
Caller with the last 3 digits, 904. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, my name is Alex Camberos. That's ALEXCAMBEROS, speaking on behalf of Battleborn Progress in support of SB 211, creating a standard of care for routine, confidential, and convenient STI testing would destigmatize sexual health and reduce the spread of STIs and HIV by promoting access to testing and treatment. I want to echo the comments of the other members in support, and I want to thank that Senator Harris for presenting this critical legislation, and we ask the members of the committee for their support as well. Thank you.
Broadcast Services, do we now have anyone else on the line in support of Senate Bill 211?
Yes, Chair, there is another caller. Caller with the last 3 digits, 085. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, my name is Alyssa Cortez, spelled ALYSSA, last name Cortez, CORTES, and I would like to thank Senator Dallas Harris for bringing this really important legislation up for a hearing. I am here to, sorry, excuse me. We are very supportive of Senate Bill 211, and I represent Silver State Equality as a program associate. So thank you so much, and I just want to say ditto to what Alex Camberos had said before. Thank you.
Do we have any other callers in support? I'm not going to lie, I kind of like it when people are able to participate no matter where they are. I think it's an incredibly inclusive part of this new post-COVID legislative process. But on Broadcast Services, is there anyone else on the line?
Chair, there are no other callers wishing to participate in support testimony at this time.
Thank you. Now we'll go to the room. Is there anyone in opposition to Senate Bill 211? Seeing no one coming up to the table, is there anyone on the telephone line in opposition? Broadcast Services.
To testify in opposition of Senate Bill 211, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to participate in opposition.
Thank you. Is there anyone in the room that would like to testify in neutral on Senate Bill 211? Seeing no one coming to the table, is there anyone on the Zoom that would like to testify? And I see a hand raised, so please go ahead and unmute yourself. And I wish I could read names on that screen, but I cannot see that part. Lynch. Miss Lynch, go ahead when you're ready. I believe you're still muted. still muted. Well, I believe Miss Lynch is neutral. Is that correct? Thumbs up? There we go. Is there anyone else on the Zoom that is in here to testify in neutral? Seeing no one else lighting up their screen. Broadcast services, if we could go to the phone line in neutral.
To testify in neutral to Senate Bill 211, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify in neutral at this time.
Thank you. And Senator Harris, if you have any closing remarks, I would turn it back over to you for those.
Thank you so much, Chair Wynn. Dallas Harris for the record. I just want to thank the committee for their time and for their thoughtful questions today, as well as, again, thank Ms. Radeloff and Ms. Howell, who have been absolutely instrumental in helping me draft this legislation. So thank you all for your time.
Thank you. And with that, I will close the hearing on Senate Bill 211. And at this time, I will open the hearing on Senate Bill 456. And I believe Miss Bierman that's going to be presenting this bill here today? I believe it is. I see her on the Zoom. Again, Senate Bill 456. I'll open that hearing. It does revise provisions related to the state dental health officer, and I will turn it over to you to begin when you are ready. I see there are a couple other people that lit up, so I believe you have some co-presenters or at least people there to answer questions, I believe. I just remind presenters to please clearly state your name each time before you speak so we can keep a good record. And I will let you begin when you're ready.
Thank you. Good afternoon, committee members. For the record, my name is Suzanne Bierman, and I'm the administrator for the Division of Healthcare, Financing, and Policy, and I'm here today to present SB 456. The division's budget included a transfer of appointing authority for the state dental health officer from the Division of Public and Behavioral Health to Medicaid. This bill implements the division's budget. Transferring this position results in state general fund savings because the division can receive a greater federal share of 75% for funding of this position with the transfer as approved in our budget. So with that, I am joined today by Deputy Administrator Cody Fenney and the state's dental officer, Dr. Antonina Capurro, and we would be happy to answer any questions the committee may have.
Thank you. That was very brief. I'm looking around here. Does anyone have any questions regarding the bill? Go ahead, Assemblywoman Peters.
Thank you, Chair. While I'm on a roll, I'm going to ask one about this one too. I'm just curious about the move of the state dental officer, and I can't remember, so you have to remind me. The state dental hygienist, where that position is located, and if they're not in the same under the same division umbrella, can you just express why that difference is okay?
Good afternoon, Cody Finney for the record. I'm going to take a swipe at that if Ms. Bierman doesn't mind. The oral health program was started in the Division of Public and Behavioral Health several years ago, and I happened to have been part of implementing that. So the state dental hygienist and the oral health program will remain at DPBH. While Dr. Capurro is the current incumbent, she will come over and continue working on Medicaid policy with us, but officially and in the budget. But the collaboration with the oral health program and the state dental hygienist will continue within the overarching umbrella of Health and Human Services. So from our perspective, it's not an enormous difference, but it does allow us to collect that additional federal participation. Does that help answer your question?
It does. Thank you. That clarifies for me.
And I'm looking around. Do we have any other questions from committee members at this time? Seeing none, I have one here from Assemblywoman Summers Armstrong.
Thank you, Madam Chair. Thank you, Ms. Finney. You seem to know the setup. So, Ms. Capuro is the hygienist. What's the difference between, no.
I'm sorry.
Go ahead.
Cody Finney for the record. Dr. Capuro is the state dental officer. She is a dentist. There is a different incumbent that is currently the interim state dental hygienist. And her position does not move.
Thank you. We had another bill, AB 391, and I read this and kind of got confused, but now I'm clear. Thank you very much. I appreciate it.
Do not apologize, Assemblywoman Summers Armstrong. I think we are all at that point where they're all blending together. But they are interrelated and they are all on the same committee, so it makes sense. Do we have any other questions from committee members at this time? Seeing none, I will begin testimony in support of Senate Bill 456 in the room. I don't see anyone coming to the table. Is there anyone on the Zoom to testify in support of Senate Bill 456? And if you are, I would ask you to unmute and begin your testimony. I don't see anyone. So at this time, Broadcast Services, is there anyone on the line to testify in support?
To testify in support of Senate Bill 456, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in support.
Thank you. At this time, I will look to testimony in opposition of Senate Bill 456 in the room. Seeing no one, Broadcast Services, is there anyone on the line to testify in opposition?
To testify in opposition to Senate Bill 456, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in opposition.
Thank you. And I will next go to testimony in neutral. Seeing no one in the room coming to the table, is there anyone on the Zoom to testify in neutral of this bill? And I don't see anyone. I just saw someone registered, but I don't see them turning on. So Broadcast Services, is there anyone on the line?
To testify in neutral to Senate Bill 456, please press star 9 now to take your place in the queue. Chair, there are no callers in neutral.
Thank you. And with that, do you have any closing remarks to make, Ms. Bierman, or would you like me to close this hearing at this time?
I do not. Thank you, Assemblywoman.
Thank you. And with that, I will close the hearing on Senate Bill 456. At this time, we'll go to the last meeting that we have on the agenda for today that we will be doing, which is public comment. Before we begin public comment, a reminder, please, you can always provide your comment by phone. You can submit your comments on the bills within 48 hours via writing. And all of that is listed on the agenda and also on Nellis. So Broadcast Services, is there anyone on the line for public comment?
To participate in public comment, please press star 9 now to take your place in the queue. Chair, the public line is open and working, but there are no callers to participate at this time.
Thank you. And that I will close public comment. I'm looking around the room. Are there any comments from members before we adjourn for the day? Seeing none, this does conclude our meeting for the day. Just to give you a lay of the land for the next couple of days, you will probably see an agenda for call of the chair scheduled for the next couple of days, just kind of keeping it open and flexible as we move through this process to close out the session. So with that, a meeting is adjourned.